So before I begin my talk, I have a disclaimer to make. I work for Remidio. Remidio works on artificial intelligence enabled multimodal ophthalmic medical devices. And what we do is we do this. We do AI, oculomics, and point of care devices. I'll come to the oculomics part in the second part of my talk, but let me first talk about what we do for AI in ophthalmology. What our story so far? We have close to 10 plus products. We have impacted almost 16 million patients. We are present in 40 plus countries, around 4,000 device installations, 60 plus research publications, and 37 grants. And we focus on product design, and all our products are clinically validated and relevant and safe to use. So we have this product, what we call it as eye clinic in the bag. Basically, you can take the bag, it's your whole eye clinic. You can take a picture of your eye, you can measure the pressures of the eye, you can take a picture of the front portion of the eye, you can tell whether they have a cataract or not, and you can also measure the pressures in the eye. Now all this, you need a technician or an ophthalmologist to use the devices. Now what we have done on top of this devices is we have built AI models on top of it so that this can be completely decentralized, where a technician can take a picture of the eye and then say whether they have an eye problem or not, and they can be referred to the ophthalmology clinics, right? So our devices can take a picture. So what you see, that red color thing there is the back portion of the eye. That's the retina. Okay, you take a picture of the eye and we run AI models and we give outputs like that and say whether they have an eye problem or not, and that can be referred. We'll talk more about this, how we developed it. But before that, AI, if you see, AI as SAMD, SAMD stands for Software as Medical Devices, is more common, predominates in sectors where imaging is more, right? You can see that radiology tops there. This is a figure some are taken in 2022, something 2023, right? It's not even an updated figure. And you can see that ophthalmology also shows up there. So ophthalmic is fourth in that. So any field which has imaging modality dominates, AI finds its place there. Now, in ophthalmology, we take a lot of pictures. You can take a picture of the eye and then predict all these conditions. You can tell whether they have cataract or they have angle closure glaucoma, whether they have a tear film problem, whether they have corneal problem. Similarly, you can take a picture of the back portion of the eye and say whether they have sight-threatening eye conditions like diabetes, glaucoma, retinopathy, or prematurity, or you can even say how they are going to progress in future. So you can even do not just detection analysis, but also can do the progression analysis, right? So again, various applications of this in this is you can use AI to do just classification, just reiterating what I said in the previous slide. You can do a classification, or you can do a segmentations, or you can do a disease detection, or you can use a transfer learning method from one modality domain to predict what would be. For example, I can predict what is going to be the functional loss of the vision just by taking a picture of the retina. So I can do a transfer learning approaches as well. Now, little bit about AI development, because we have done it. The way the AI needs to be developed is you follow these pipelines, right? Now, if you see this pipeline, the first row is model development, the second row is model deployment, and the third row is your clinical applications. Now, when you do model development, your usual things comes up: model, clean the data, training the model, evaluating the model. Model deployment, yes, you deploy the model, find out appropriate regions where you want to deploy and deploy. When it comes to clinical applications, right, that's where our focus is mainly on, and we look at how we can use the AI models to triage patients, how we can use it in the screening and treatment space, how we can validate our AI with scientific publications, right? Now, we also consider all these bioethical principles when we developed our AI.